Hi, it's the Chappiness guy. Welcome to today's episode of Vestibular Talks. Today's special guest is Preeti. Preeti is a vestibular physiotherapist doctor that specializes in dizziness and concussion. She's also the owner of Dizziness Rehab, and she's going to talk to us today about the different vestibular conditions, different treatment options, and as well as how viral infections such as the herpes virus or Epstein Barr can cause vestibular neuritis or other vestibular symptoms. I hope you enjoyed the episode. Remember to like, share, and subscribe. On your choppiness, guys. Hi, Preeti. Welcome to this episode of Vestibular Talks. How are you today?
I'm great. Thank you so much, Juan. Thank you so much for having me here on this
Oh,
talk.
it's my pleasure. Would you mind telling us a little about who you are and what you do?
Yes, so my name is Preeti Jedia, and I am a physical therapist. I've been practicing physical therapy since 2009, and I have done masters in neurosciences. So I've done a master's of physiotherapy in neurosciences from All India Institute of Physical Medicine and Rehabilitation. It's an institute in India, in Mumbai. I've done my master's there. Since then, I've been practicing neurosciences. So just anything related to neurology, I've been practicing that. But when I came to Canada, I did switch a little bit towards orthopedics. And now I have switched my practice to vestibular therapy. So I'm a vestibular physical therapist, and I'm very happy that I chose this field finally.
Awesome. Preeti, how do you get involved with the vestibular therapy? Why vestibular?
Okay, so in 2017, I did my first vestibular course because I wanted to learn more about vestibular rehab. And actually, since I have a background in neurosciences, um, vestibular system is a part of neurology. And when my professor used to teach us vestibular system, it used to go over my head, and I was like, why is this system so hard to learn? And truly speaking, I always avoided that system. It's like it's very hard, it's very difficult to understand, and there are these, the symptoms like nystagmus, dizziness. Those symptoms are so difficult to understand, as a
Yes.
therapist as well. So I always used to push it away, and then in 2017, I took this course, Introduction to Vestibular Rehabilitation. I took that course and I saw my first patient in 2017 for Bppv, and I treated that patient successfully. And I was like, oh my goodness, this is wonderful. Like, I love it. In
Yeah.
each session, I was able to get rid of their symptoms. And that was so powerful for me. And then from then, since 2017, I decided that I'm just going to dedicate my whole life, my all the studies that I've done to vestibular rehab.
That's awesome. And you're right. You're right. It's a very complex system because, as you said, the symptoms are very complex, and many therapists, many doctors, many people try to stay away from it because of that. Because it's very
Yes.
hard to treat a dizzy patient because not all dizzy patients are the same. Everybody has it could be BPPV, it could be vestibular migraines, it could be Meniere's, it could be so many different things. So
So
I'm
many.
very glad that you were able to help this person with BPPV because you probably changed their world for the better because if they were struggling with vertigo, with dizziness, with the nausea, and then with your treatment therapy, you help them, then it was probably like, hey, like this is awesome, like this really does work. Yeah, no, that's
Yes,
amazing.
absolutely. Yeah.
Uh, Pretty. So you are in Canada. How has the COVID condition affected your practice and the way how you see patients?
So interestingly, when COVID hit, we started learning how to do telehealth or virtual. So I was working in Victoria in British Columbia. So I'm a licensed physical therapist in two provinces. I can practice, like, I can see patients from British Columbia and Alberta. So when I was in BC, in Victoria, obviously COVID hit, we were not able to go to the clinic, and then we switched our practice to virtual therapy. And then when I started doing the virtual therapy, I felt that it is such an important part of physiotherapy right now, and for all the medical profession, because you can see the patient in their home, in the actual surrounding, what they are living in,
Yeah.
and you're able to connect to a lot of the patients from different regions. So for patients who are living in outskirts and they don't have the access to physiotherapy, and they are able to communicate to us from sitting at their home, obviously they need internet, that's big thing. Yeah, and so I felt COVID has changed my perception of just doing in-person physical therapy, that physiotherapy is not just in person and not just touching you and like pushing on your joints. It's not that. It's a lot more than that. So I feel like COVID has really changed my mindset in that regard.
Yeah, it opened like a whole new universe to reach, like you said, to reach more people that maybe didn't have access to seeing a physiotherapist from wherever they live. If they live in a rural area, then now they can see you and they can talk to you and get the treatment that they need. Now,
Absolutely.
let's talk about vestibular conditions. So you mentioned BPPV. Can you introduce us a little bit to what BPPV is?
Yes, absolutely. So BPPV stands for benign positional paroxysmal vertigo. And as the name suggests, so benign means it's not dangerous, it's not going to kill you. Positional is anytime you move into certain position, it is going to give you that vertigo sensation. Paroxysmal, it comes like like randomly.
Yeah.
Okay. And vertigo is a special type of dizziness. It's a subset of dizziness wherein you are going to experience the room spinning. So basically, vertigo, the definition of vertigo is it's an illusion of the movement of surrounding. So, surrounding or self. So, some patients will complain that they feel that the whole room is spinning, and some will say that something is spinning inside my head. So, there is this both version of it, and we really take it very seriously how they describe their symptoms. Because I have understood that when you listen to the patient, they will give you the answers. So, you
Yes.
just have to listen to them. So, I'm a very good listener. I've become a very good listener after getting into vestibular rehab.
Yeah, no, you're right. And dizziness itself is so complex, and I'm glad that you made that distinction. You said vertigo is a type of dizziness, because when a lot of people like me included, when I first went to the ER in the hospital because I was experiencing all these symptoms, they diagnosed me with vertigo. They're like, "Oh, you have vertigo," and I'm like, "Okay, well, like, what do we, how do we treat it? What is it?" "Oh no, it'll go away on its own. You just got vertigo, so go home." So I'm glad that you were able to make that distinction because not everybody that is dizzy experiences vertigo. There are different types of dizziness. So
Absolutely.
so yes, I'm glad that you made that distinction. Sorry, go ahead.
Yeah, just going ahead. So this was just the BPPV definition. And then
Yes.
BPPV is quite common over the age of 60 years of population. 60 years of age, it is approximately 35 to 40%. So a major chunk of population that we see is older adults. And the causes for BPPV is not specific because it's age related condition. It can happen with the other conditions too, and the viral inflammation of the nerve can give you BPPV plus BPPV. So the causes are not defined for BPPV.
Yes.
And when it occurs in the younger population, it is most commonly due to head traumas.
Yes, yes. I was just gonna say, I heard that people get a concussion or something, and then it triggers their BPPV. Yeah.
Yes. So that is BPPV, and the treatment for BPPV is first thing. Sorry, I would not go to treatment first. The assessment for BPPV is very important. So a detailed, comprehensive evaluation, or just the history taking, or the interview with the patient will let us know what kind of condition they are having, and then we go for the assessment. And in the assessment, we put the patient in a specific position and we look for their eyes. And if we find specific type of nystagmus, which is the torsion of the eyes, which just the eye movements, involuntary eye movements, and that way we are able to diagnose if it's BPPV or not, and then you do the maneuvers to treat them.
Yes, pretty. a question that I get asked often is people tell me, I've had Bppv, can it come back?
Very good question. I have had the same questions, and yes, Bppv can come back. The recurrence rate for Bppv, the literature says around, if I'm not wrong, 30 to 40%. That's how much in the first year that you get it. I have had patients who have come back with Bppv. That's the only thing I can say. Yeah.
But the good news about that is that you can do the maneuvers again and try to resettle it again, and it will be gone again, right?
Yes, yes, absolutely. Absolutely. And so even if it comes back, I tell my clients that even if it comes back, you know now what it is. So you don't have to get anxious about it, that you're getting that. I know the symptoms are very horrible. It's a very, very horrible sensation, but is it dangerous? Probably not. So I explain them in such a way that next time when they get it, they're more calm. They're like, oh, I'm having vertigo, but I know I can handle this. And I was like, okay, great.
That's a key thing, Pretty, because you're right. The anxiety that these vestibular conditions create, it's overwhelming.
It's over.
Because when you are out of control, you don't have balance. You feel like you're really dizzy. You feel like your eyes can focus. Like you get so scared. You're like, well, am I having a stroke? Am I having MS? Am I having a heart attack? Like you start to panic and create these worst case scenarios in your head. So you're right. Having control of this anxiety is key, because it kind of like helps you to, as you know, anxiety increases the effect of the symptoms. So when you calm down a little bit, then the symptoms are not as difficult to manage. But I do agree, it's a very horrible sensation to have. Yes.
Yeah, I've had it once, so I can feel it. I can feel you
Really?
guys. Yes.
Yeah, it's not fun.
Yeah,
It's not fun.
I've got dizziness. I've got a little bit hearing loss on my right side, and I've got one episode of dizziness, and I do get motion sickness. So I'm completely aware of how and what it feels like, and I cannot play video games.
Yeah, no, it's not fun. I'm curious. This might not be related to it, but what are those stickers in the back? Are they for vision therapy?
Yes, they are for exercises, because I do virtual therapy. So I sit in this room and I teach my patients how to do those exercises. This is one part of wall clock saccade exercises. So a part of vision therapy, not completely. And because you know how visual and vestibular system are closely connected, right? Your whole vestibular system sort of controls your visual movements. And when the vestibular system is down, your your visual system is not able to catch up with the speed. And that's why you get dizziness, right? So I train them for the vestibular ocular reflex exercise, which is the adaptation exercise. You must be knowing, you hold X and then you shake your head.
Yeah.
That's one thing. The other one is the wall clock saccade, is you are looking from center to the peripheral clock, and then you move your eyes as fast as you can from that, so that you're developing those saccadic eye movements.
Yes, yes, and it is very helpful. I've done it before, and it does help, like you said, with the movement, because when you get affected by these vestibular conditions, movement, like seeing a car drive by or a train, like your eyes, it's like they can process what's happening. They start to shake back and forth, and your mind is like trying to make sense of it, and then you get really dizzy. So those exercises are really good to help you kind of like habituate your eyes to have control of that kind of movement. Yeah.
Absolutely.
Pretty. Now, other conditions like triple PD, vestibular migraines, Meniere's disease, they all have, how would I put it? They have symptoms that affect the vestibular system. Like the symptoms are related to the vestibular system. Would you recommend vestibular rehabilitation therapy for these other conditions as well?
Yes, I would. But first thing, for example, for vestibular migraine, if a patient comes to me and they have these symptoms of headaches, migraines, aura, and the vestibular symptoms associated with it, and they haven't seen a healthcare practitioner for their medical management, I wouldn't start their vestibular therapy right away. But obviously, I'm going to give the education to them. I'm going to ask them to calm down. So just the basic vestibular education piece of it. But these patients need to be managed medically as well. That is very, very important. And especially with Meniere's disease too, because Meniere's disease is an unstable condition. And I cannot start my vestibular exercises if my vestibular system is not stable. So for BPPV, it's a stable condition. For vestibular neuritis, it's a stable condition. Once it happens, it is not going to progress or it is not going to fluctuate. But vestibular migraine, Meniere's disease, triple PD, I can start with them right away, but obviously I have to make sure that they are under medical help as well, and then I can start them with the vestibular rehabilitation exercises.
Right, and every vestibular rehabilitation therapy is very unique to each patient, correct?
Absolutely. You have to customize it as per the client. Some patients can do the same exercise for 2 minutes and some cannot do it for a few seconds. So you have to customize them as per what the patient can do, how they can start with, and yeah, just progress from there.
Yeah, yeah. Pretty. So many things have been kind of like introduced into the therapies of vestibular system. For example, the virtual reality glasses help you find the nystagmus, or also they help you see kind of like videos to adjust your eyes to the virtual movement. Also, I've seen that there is this crazy chair where you sit patients and it spins them in every possible way. Do you see the next coming years that we're going to keep evolving and finding new things to help vestibular patients? Or do you say that is kind of like slowly moving and eventually getting there, but very slow?
So this is a very good point that you brought. Vestibular rehabilitation therapy has evolved. Like 40 years ago, you would see that there was no therapy for Bppv. There was nothing. They were for Bppv, people were doing, like the surgeons were doing, ENT surgeons, they were doing surgeries for it. And then Dr. Eppley's in 1992, sort of, I hope I'm saying the date right, it's probably 1992, he got this maneuver, okay? And that has been like a game changing in BPPV treatment.
Yeah.
And since then, there has been a significant rise in evidence-based practice. People are like the whole healthcare faculty are working hard. All the vestibular therapists, ENT, otolaryngologist, otologists, they have come together to find more and more innovative ways to treat these patients without doing surgery for like a simple condition like PPPV. So I truly believe that in the next coming years, 10 to 15 years, there will be such an evolution in treatment for vestibular pathologies. So virtual reality, I don't know much more about the chairs that you were talking about, the rotating. I have heard about it, but I've never personally seen it or never personally done on me. So I'm not quite aware of it, but I definitely know a lot of aerospace, how do I say, the aerospace engineering, that's where the most of the vestibular system sort of like technology is coming from. Yes, because
Yeah.
sorry,
It seems to be evolving at a quite fast pace. And even I saw the other day an article that said that there is this insert thing, like this little machine that they put on people that are having vestibular dysfunction, something in both sides. I can't remember the exact name of the condition, but apparently these are people that are completely lost of balance. Like they can't stand. They are in a wheelchair or using a cane to walk. I guess if they implant this little thing, then it helps them regain some of their balance. It's not a cure, but it helps them regain some balance and some mobility. So I agree with you. I think that we are innovating and coming to realize that new technologies can help vestibular patients.
Absolutely. There is another thing that I recently learned about is autoband. So you wear this band in your hand, and when you go for this is for people with motion sickness. So when you put that band on and you're in the car, passenger side, and you won't feel motion sickness, like, wow, that is incredible. I should try it too.
Yeah, yeah, yeah. Because I am like you. Like if I'm driving, I'm okay. But if I'm in a passenger seat or if I'm sitting in the back of a taxi, no dice. Like everything is just, yeah, it's not fun. It's not
No,
good.
fun. Yeah.
How important is it for vestibular patients to still move? Because often, like when it happened to me that I got my big episode of vestibular migraines, and I was so dizzy, I wanted to stay still. Like my neck was tense and everything because I was staying still. I didn't want to move. I would crawl around very slowly, hanging onto the wall. Now I can drive. I can ride bicycles, things like that. How important is it to continue moving?
Very, very important, because our vestibular system takes information through movement. So if I'm not moving, if I'm keeping my head still, my vestibular system is not going to get any input. And then my vestibular system will think this person is not moving. Why do I have to work? So I always use this analogy of neuroplasticity, use it or lose it. So if I'm not moving my head or if I'm not moving my body, my vestibular system is not going to get any information. And the ability for it to function will keep coming, will keep it down. So for example, I'm going to give you a very simple example for someone who has undergone surgery, any surgery. They are in the hospital for 2 weeks, okay, and they haven't moved. They are in the bed, they are bedridden, and then when they get up and walk, the first thing they will feel is, I am very dizzy. Okay,
Yeah,
their vestibular system hasn't got any input because they have been on the bed for 2 weeks because of whatever reason.
yeah.
Now the vestibular system is taking some time to catch up with that movement. So I say to my patients that the only way that you're going to improve the function of improve the lost function of your vestibular system is by movement. So very important. And I have actually on my website for Dizziness Rehab, I have written a blog on it. Why do you feel what you're feeling? And then it very beautifully explains the vicious cycle of anxiety and vertigo. So if you're not moving because of your vertigo and dizziness, your body is going to become very tight, your neck is going to become very tight, your vestibular system won't get the information, and then it will send a signal to the brain that this person is not moving, I'm not going to work. So it's going to go down, and then the cycle continues, and then the anxiety keeps going up.
Reason. Yes, you're right. You're right. Uh, these conditions. So how would I put this? It's as we talked earlier. They are very unique. Even if people have the same diagnosis, their symptoms can be very, very different. For example, I've talked to a lot of people online that have vestibular migraines. One of my symptoms at the beginning that was extremely strange, it was that the whole world was tilted 45 degrees to the right. I will see everything tilted, and not everyone that I've spoken to has they had the same symptom. So for you as a therapist, trying to identify basically what their symptoms are, what their condition is, what if they don't have a diagnosis, I'm talking about if they don't have a formal diagnosis by a doctor, was kind of like your strategy to determine, okay, this person may have Bppv, this person may have Meniere's, this person may have vestibular migraine. Like, how do you kind of like manage to navigate through that to find out what they could have?
Yes. So when a patient comes to me with no diagnosis, interview with the patient. So just sitting down, listening to them, what and how they are describing their symptoms. So our vestibular system is very much dependent on movement, right? So the patient will say, oh, I was just sitting one day and then I suddenly started getting dizzy and vertigo. Okay, with not doing anything, that is something spontaneous. Okay,
Yeah.
and then another patient will say that I was rolling on the bed at night and I felt the vertigo and the spinning. So that was movement driven. Okay. And then also the age range will determine what condition they can have, because I know that BPPV is very common in patients over 60 years of age. And if a younger person like you, if comes to me with vertigo, dizziness, I'm going to be less suspicious for you to have first BPPV, but I'm going to be more inclined towards your other symptoms. So I'm going to ask you about headaches, history of migraines, history of motion sickness, any hearing changes. That is very, very important to
Yeah,
know from our patients. Are they experiencing any hearing loss, any hearing fullness, ear pain, tinnitus that's ringing
yeah,
in the ear?
yeah,
Yeah. All these symptoms will give me a clue whether this is a simple BPPV or is it a complicated, like, vestibular migraine, Meniere's disease. Meniere's disease patient will give us the um, will give us the symptoms of they will have fluctuating. So they'll be bad for a few days and then they will be better for the next, like that. So duration is very important. How long your vertigo lasts, how long your dizziness lasts. Does it remain for the whole day, for 2 or 3 days? So duration will categorize these patients. And then obviously the assessment after that.
yeah, you're right. Pretty. You live in Canada, in Alberta, like me. I live in Calgary. You're in Edmonton, right?
Edmonton, yes.
Now, what I love about doctors like you, that you're young, you're intelligent, is that you are open-minded to understand these vestibular conditions. Because some old school doctors, they either say that everything is vertigo, or they say that everything is Meniere's, or they basically say to people, it's all in your head. This is like you're imagining it. So what I'm glad about young doctors like you is that you have the open mind to actually listen to people and acknowledge their symptoms and their condition. How important is it for you as a doctor when you see that a patient actually feels that you listen to them and they feel like that relief of like, yes, you believe me? How do you
Yes.
experience that?
It is so very important to listen to the patient, and then what these patients, all the vestibular patients, what they are going through is nobody is understanding them. Nobody is understanding these symptoms because these symptoms, that vestibular injury, concussion injury are invisible injuries.
Mm-hmm.
Like I don't have a broken arm, right? Because broken arm can be seen from outside. I'm in a plaster, right? I don't have amputated arm. People
Yeah,
can see from outside all these conditions. And when you go for the testing as well, your MRI will come normal, your CT scan will come normal, right?
blood work comes normal. Yeah,
Blood work comes normal. So it's a complete invisible injury. These patients are struggling to tell them, to explain the symptoms to the doctors, and then doctors. I'm not against any doctors, but obviously the training that they get is not focused towards vestibular side.
yeah,
But as vestibular physical therapists, we are trained to understand these symptoms. And when the patient tells us that they are feeling that something is floating in their head, we actually understand what they are saying because probably there is something floating in their head. That's what the feeling is,
yeah,
right? And floating, swaying, swimming. I have a patient tell me that there was something crawling, that kind of sensations. And they feel the pressure in the eyes,
yeah,
they feel the pressure in the neck, all these symptoms. When they tell me, then I can actually understand that, oh, their vestibular system is not functioning to optimal, and that's why it is giving this all weird sensation which nobody else is able to understand. I've
yeah.
had a young patient from India, actually had a vestibular injury 3 years ago, and since then he's been feeling floating and swaying. He's just floating. He has this, and he's been trying to explain these symptoms to the ENT doctors there, and no one can understand. And once he spoke to me and I told him that this is why probably you're feeling all the symptom, the line that he said that, wow, you're the only one who can understand this. And I was
Yes.
like, yeah, yeah,
It makes a big difference in a patient's life because you're right, the symptoms make you feel like you're going crazy because they are so strange and so hard to explain. So when someone finally acknowledges and says, yeah, like I know what you're talking about, you're like, yes,
yes,
yes, finally. Yeah.
yeah.
Pretty. Now, when this happened to me in 2019, I've seen many doctors, specialists, neurologists, ENTs. I've seen so many people. Many of them started saying they're like, I don't know what's in the air because so many more and more patients are coming to complain of dizziness.
Hmm.
Do you feel that is because people are actually uh, now recognizing this dizzy sensation, dizzy conditions that are going to see doctors more often? Or do you feel that because, I don't know, as we age or viral infections or I don't know, anything else is causing more and more people to be dizzy. Like, what do you think this increase of or acknowledgement of dizzy patients?
Both ways, people are getting more and more educated and educated about these dizziness symptoms. And a lot more is there on the media, on Google, on media like Instagram, social media. People are posting their experiences, and a lot of patients are they are finding it very relatable. So
Yep.
they understand that, oh, this dizziness, what I'm feeling, it's not just in my head. Probably there's something more going on to it. So there is that component too. Plus, now this is just my belief, it's
Yep.
anecdotally, is the stress levels. Like since COVID has hit, I have seen a surge in my patients and coming with complaints of dizziness. They were absolutely fine, and then COVID hit. It was very stressful for everyone in the world, actually, not just
Yep.
one, for everyone in the world. And the inactivity, right? Like during COVID times, we were not very active.
Quarantine and stuff.
Yeah, quarantine and all the stuffs, and we were not active. So a lot of my young patients with no other vestibular problems, nothing, have just come back to me saying that I am dizzy now.
Yeah. Yeah.
Yeah. So because we know that once your stress level increases, and I'm not talking about just the daily routine stress, because stress levels, we need a little bit amount of stress, right? But if we have a significant amount of stress, our immunity goes down. And then when the immunity goes down, we already have lots of viruses in our body. They just
Yep.
activate. And one simple example for you is the viral neuritis.
Yeah.
And that is, I was reading a paper by Michael Stroop, and they were talking about the vestibular neuritis can happen because of reactivation of a latent herpes simplex virus in our body. And we
Epstein
all
Barr.
have it, right? And we all have it. And it's just depending upon how much our immunity has gone down, the virus is going to activate and attack our nerve. So this is my theory, and that's just
No,
anecdotally,
and I am 100% with you on that one, because I've read so many articles about it and
Yes.
so many anecdotes from people that have actually experienced it. They had the herpes complex Epstein Barr virus in their system, and
Yeah.
and because they were stressed out, or they were anxious, or they had like maybe a family member died or something like that, so they were very like mellow and very sad. Something hit them and affected the vestibular system,
Yes.
and they believe it was the Epstein Barr virus, the herpes virus, that
Yes.
was already in their system, but when their immune system was kind of like down, the virus like took that opportunity to attack.
Yeah.
So yeah, so I completely agree with you. I think that's, I'm not saying that's the only reason, but that's a huge possibility of why so many cases keep increasing. Yeah, you're right.
We are seeing more younger population, between 20s to 40s. I'm seeing more of that population rather than people who are like in older age group, like 60 and 65 plus. I still see a lot of Bppv in my 65 plus population, but I'm seeing the other anxiety, dizziness, and vertigo, vestibular migraines, all those triggering just out of nowhere. They are stressed, they have a life event, and then it just.
Yeah, no, you're right. I love it that you mentioned that, because it's so true. It's so and it's something that not many people relate to it, because you don't think, oh, the herpes virus, why would it cause that? But yes, it's a virus that attacks your vestibular system and gives you neuritis, which
Yeah.
then can wake up, because you can have comorbidities that wake up other conditions. Like it can start with vestibular neuritis and evolve into vestibular migraines, or evolve into a more chronic state of Bppv as well, right? Or triple PD. So something
Yes.
can kind of like cause it, but that leads into this domino effect of more and more symptoms and conditions. Yeah. Now,
Totally.
Preeti, what does the future hold for Preeti?
Uh, so I love learning and I love teaching.
Yeah.
Okay. So my goal of having this virtual platform, Dizziness Rehab, is to create as much awareness as I can in both the population, the affected population, like in the patients, and in the medical fraternity as well, in the medical world as well. And in between, I want to start taking more and more educational courses for my physio students in India, in Canada. So just holding, not taking courses, so holding, conducting
Yeah.
courses. Yeah, so I want to go into more teaching and then obviously taking care of my patients as well. So
Are
yeah,
you familiar with the, it's in the States, the VIDA, the Vestibular Disorders Association? Um,
yes, I
because
am.
you are registered with,
Yeah,
oh, awesome.
I'm a member of VIDA. Yeah.
Okay, awesome. So I was gonna say that since you're in Alberta, for people that are looking for a vestibular physiotherapist, if they go to Vita, they can probably find you through them. So
Yes,
awesome.
absolutely.
Now,
Yeah.
Pretty, how else can people find you? Where, like you mentioned, a website. Like, how can they learn more about you?
So my Instagram handle is called as Dizziness Rehab, and although I'm not posting too much on it because I'm busy with something else, but definitely I'm gonna get into full swing. But that's one platform. My website is dizzinessrehab.com. People can find me there. Also in Alberta, I am a clinic partner of a physiotherapy clinic in Alberta in Edmonton that's called Glen Riding Physiotherapy. So if someone wants to come and see me in person, they can come and see me at this clinic. I have vestibular goggles that I use. I have created a system, my business partners and I, we have created a system to train balance. And this clinic is specialized into dizziness and concussion clinic. So anyone and everyone who has dizziness and or concussion, this clinic is specialized into it and they can come and come and see me personally there. Yeah.
That's awesome. Thank you. And Pretty, my last question to you is: this channel is called "Find Your Chappiness," which means
Yeah.
find your happiness.
Yeah.
How does Pretty find her happiness?
Uh, so that the thing that comes from my heart is playing with kids. I love children, and because they are so pure, I just love being with them. So I will talk to my nieces and nephews in India, and I will just listen to their stories, and it is so beautiful to just be with kids and play with them. You can actually it melts away all your stress and tension. That's how I find my happiness.
Awesome. Well, Pretty, thank you so much for being part of this episode. I'm happy that you're in Alberta, so that's great. Maybe sometime I can come and visit in Edmonton and see your clinic as well. And
Absolutely. I would love you
yeah,
to come and visit. And I have been listening to your vestibular talks, and I just heard your talk with Veta from Russia,
yeah, yeah.
Sweta, or yeah,
It's
and
Vieta.
yeah, Sweta, and it was so inspiring. And it was she is such a fabulous lady, like
Oh, she is. Yeah, it's
so
something else
inspiring.
for sure.
Yeah,
Yeah.
and I've been watching the Life Rebalanced Chronicles,
Oh,
which
you saw it.
I saw it, and which the Vestibular Warriors have come together and created that, and it is such a great content. I am just loving it. So I am following Vida, I am following Talk Dizzy to Me, and I've been
Yeah,
just constantly working on improving my dizzy education, I would say, learning
network. Yeah, yeah.
network.
No,
Yes,
that's
that's
awesome. Well,
yeah. Thank
yeah,
you so much for starting this channel. It is very inspiring. Very
awesome.
inspiring.
Awesome. Thank you very much. I appreciate it. And we'll talk soon.
Yes, we'll talk soon. Thank you so much. Bye.
Bye.